If you decide to come back, come on back.
Okay.
Is that hitting the right place? That's close enough, I guess, isn't it? Okay. When the Europeans first came to the Americas, this is, we were talking about the French doctors and American doctors. They're different. I showed you the picture of the French clown. Okay. Mm-hmm. At the hospital. They spend a lot more time in the hospital in France. But the French have been different than other Europeans. Their medicine is world-renowned, but it's not the same as English medicine. It's certainly not the same as American medicine. When the Europeans first came over here, one of the things you guys complained about was the fact that Europeans stink, and they do. Europeans stink. They stink today. I can remember traveling in a bus in Germany on a Friday afternoon. Well, geez, these guys hadn't had a bath. They only bathe a couple times a week. They bathe on either Friday night or Saturday night. And the reason they bathe is so that they can go to church on Sunday. So traditionally they only bathe once a week. The French don't bathe that frequently, and they do have an odor about them. The Germans, of course, if they're physical laborers, these guys are sweating all day long, and they don't bathe through the week. So by Friday, they're pretty ripe. Well, one of the things that we know is that when the Europeans first came over here, you guys complained about how bad they smelled. And you were right, they stunk. But there's a reason for it. There's a reason why the French smell so bad. The reason is because they don't bathe. And the reason that they don't bathe is because for the last 400 or 500 years, they've had this concept that bodily secretions will protect you, keep you from getting sick. So they don't bathe in order to protect themselves. They don't even wash their damn hair. So they don't wash nearly as frequently as we do. The French maybe bathe once a month. The Germans bathe once a week, as I told you. As Americans, we bathe every day. The Japanese bathe every day. When the Europeans first came over here and encountered the indigenous populations, they were appalled by the fact that you guys bathed every day, one way or another. You bathed. But they didn't. And the French were especially bad. These were some really smelly people. They didn't bathe more than once a month. Now when I say bathe, I'm talking about their hair. So they had the grease, you can call all Europeans grease balls if you want, because they are. They don't even wash their hair. 1976 article in Le Monde stated that the French hospital patient had the right to a monthly bath and to weekly foot washings. There you go. So if you were in an American hospital, how often would you bathe? Every damn day, you bet. French dermatologists recommend that people, even those with oily hair, not wash their hair more than once a week. Now you understand why the hairstyles are so strange. I'll watch a movie and I'll go, oh my God, why didn't you wash your hair? It's so greasy. But, that's just the way they do it in here. So if you watch a French movie or a German movie or an English movie, you may see a lady with really stringy, greasy, ducky hair. Looks like she hasn't washed it in a week, and the reality is that that's the way it works. I had a sister-in-law that would wash her hair once a month. For some reason, she adhered to the French idea of when you wash your hair. And I'll tell you what, her head smelled bad. They claim that the more you stimulate the hair follicles, the more oil that you're producing. So you're just making your hair oilier by washing it. So they only wash their hair. Yeah, I know this thing's horrible, doesn't it? I wash my hair every day, damn it. And if I don't, it looks greasy because, well, I'm a European, of course, and Europeans have greasy hair. That's kind of a odd picture. The metaphor used in the United States by doctors is that the body is like a machine that needs to be tended to regularly to ensure that it is running well. When there are problems with the body, it is often treated in ways that you might expect to see a machine repaired. And of course, when we talk about replacing knees and replacing hip joints and whatnot, taking out hearts and not hearts, you can't take out somebody's heart. Take out a kidney, you can do surgery on somebody's
We're
heart.
trying to make one, a heart that can.
The Jarvik? Good luck with that. Yeah, let's replace it with a baboon's heart. U.S. medicine is known as the most aggressive in the world. Surgical procedures are used far more in the United States than in other countries, where malfunctioning parts are removed, replaced, and or physically altered. And of course we do this all the time because we're Americans, damn it. We want everybody to be perfect. And we will do surgery before anybody else does. Before any European Frenchman. If you go to a French hospital, you go to a German hospital, you go to an English hospital, they will not suggest surgery. Canada, of course, has a medical system very similar to England because they are a Commonwealth of England. So the Canadians don't do as much surgery as we do here. When I was at Ashford, we had one of my students was he was a goalie, and he messed up his knee in practice, so he needed knee surgery. So what did he do? Of course, in the United States, we told him, you need surgery. And he said, oh, okay. So when he went home for Christmas, he got on a list to have knee surgery done. In the United States, of course, we would have thrown him onto the table and just chopped him up. But not in Scotland. He was Scottish. And of course, they have an English medical system. And so he got on a list to have surgery done. So the next summer, he had the surgery actually done. It didn't repair itself. The Scots wanted to see if his knee would repair itself, and it didn't. Of course, I mean, you can't. ACLs don't reattach themselves. That's not going to happen. But he had the surgery the next summer. In the United States, of course, we would have thrown him on the table the next day.
We give him a nice check to pay for.
Yeah, exactly. But in Scotland, of course, he got a free surgery, and it worked. He's a soccer coach now. Cool kid. U.S. doctors are more likely than European doctors to use surgery rather than drugs. But when we do use drugs, we use a lot more drugs than anybody else does. And this is one of the reasons that we're having the opiate and opioid problem in the United States. We don't give you enough pills for the week. We give you enough pills for the month, just in case that pain doesn't go away. So what we're doing is we're giving people too many drugs, and we know it. But that's what the AMA is telling us to do. Now, as a doctor, you would think that we'd be smart enough to go, wait a minute, I keep handing out all these opioids, and now this kid is addicted to OxyContin or hydrocodone. But doctors are idiots, and they follow protocols. So they keep giving people too many drugs. Damn it, they're just idiots. Sorry. I worked in medicine for 30 years, and I ran into these nimrods all the time. U.S. doctors tend to search for external causes of illness, such as bacteria and viruses. U.S. doctors prescribe more antibiotics than doctors from elsewhere, and Americans tend to have a greater concern for cleanliness and attempt to avoid contact with germs. But the reality is that germs are healthy. We need those germs. They will protect us. So we don't need to use antibacterial soap on our hands. We don't need to wipe down the counters with antibacterial soap. The reality is bacteria is good for us, and it will protect us. So if you are one of those germaphobes, sorry. You're wrong. Yes?
No, I was just announcing myself.
Oh, you're a germaphobe?
Yeah.
Okay. So you...
Make sure it's antibiotic.
Purell, yeah. Every time you go to the bathroom.
I don't constantly have it. Just
yeah. While I was driving to home and back again, I rarely wash my hands. I wash my hands here, but I rarely wash my hands because what have I touched? I opened the door and I urinated, touching myself. I'm touching myself, and then I didn't touch anything because it's got that automatic thing. So I haven't really touched anything except the damn door. What's the probability that I've contaminated myself?
Not very well.
Not very much. I mostly just touch myself. And if there was no door, and sometimes there's no door,
See,
what do I do?
Like I have to like wash my hands before I use the restroom.
Okay.
I don't understand how you can not wash your hands in the bathroom.
Why would I? All I did was touch myself, and I'm not dirty. Am I? Do I have gonorrhea on my penis?
Oh, no.
Well, not just.
I don't. What have I contaminated myself with?
Well, don't you like the
And I'm just
splash-
urinating.
Yeah, the splashes of the.
Of urine?
Yeah,
Urine's sterile.
Yeah.
it's still gross.
It's still sterile. Unless you've got a UTI. Yeah, it's sterile. There's nothing in it. I know, I used to look at it under a microscope. There's nothing there. Unless, I don't know, you're leaking sperm or something. And then that's still sterile.
The only habit I have is if I wash my hands too much. So like if I'm like super, I don't know what it is, whenever I'm really, really like anxious, I wash my hands more for some reason. I don't know why.
It's OCD, you know that's OCD.
Maybe it is.
Okay.
Maybe.
Maybe both of you guys are OCD. I used the restroom a little bit ago and I washed my hands, so I'm okay. Now it smells like soap. But if I wash my hands too much, see, one of the things that happened to me when I was working in the hospital, of course you have to wash your hands, and you're not just, and you have to use antibacterial soap. But at that time it was Physahex. Of course now we know that Physahex is carcinogenic. It was also their betadine. It was betadine. So we had to wash our hands with betadine, especially if we're going in and dealing with babies, because they certainly didn't want any bacteria. You had to scrub your fingernails, you know, the whole thing. Couldn't have long fingernails. You had to have short fingernails or no fingernails at all. They would rather that you chewed your fingernails off at the hospital, because that way nothing could get underneath your fingernails. So I was washing my hands every time I drew
Would you
blood.
file your nails?
No. I trim my fingernails. Now I don't have to. I'm not working in the hospital.
Well, just like this, I don't file my nails, but like there's just that point of where you cut it and then like it's not really long enough to clip.
Right.
So
I don't try not to clip myself that low because I like to scratch my hands. I need something to scratch myself. Okay. Germaphobe, okay. But I'm not, because of course I worked in the laboratory where we actually grew bacteria. And, you know,
You get used to it after a while.
well, I mean, you get to play with this stuff all the time. Remember, I was in that epidemic, the flu epidemic, handled everybody's specimen, and I, of course, washed my hands from time to time, but I had rubber gloves on most of the time. But I didn't get sick. Yeah, I'm scaring you, aren't I?
I don't know how you
Okay.
even get sick.
It's because bacteria are your friends, that's why.
I understand that, but like
Okay.
one of those, isn't there like a deadlier bacteria that you were handling?
It was the flu, it was a virus. It wasn't a bacteria.
Streptococcus pneumonia, have you ever done that one?
Yeah.
Okay.
Yeah, I've dealt with that before. I've had my shots. Hepatitis. We had a hepatitis epidemic that broke out on one of the Air Force bases where I was stationed. In the nursery, of course. It always starts in the nursery.
That's correct.
In daycare. It always starts in daycare. It was a pilot he had contracted it, and it got in his helmet because, you know, while you're flying, you're breathing all that moisture. It got into his helmet. Somebody else wore his helmet by mistake. Whoops. And so now we've got two guys with hepatitis. That guy had a kid that was in daycare, and he gave it to his kid. His kid gave it to everybody in daycare. Oh, it was a mess. It was so horrible. We had to give everybody a shot of gamma globulin.
How long did it take for everybody to recover?
It lasted probably 2 weeks. To recover, probably a month. The kids recovered a lot faster than the adults did because
There you
they're
go.
more resilient than adults are. Yeah, it was a mess. Anyway, yeah, I've been through all kinds of stuff. And I never get sick, so I don't have to worry about it.
That's another idea I wanted to do as just play with specimens. It's not fun.
Don't worry about it. It's great, isn't it? Okay, chapter 14 is about mental health. This is really kind of fun because we're going to talk about cultural mental health. So we have some problems, some mental health problems that are universal, and some that are culturally based, as confusing as that is. Are there any culturally based mental illnesses among the Dhat?
Taboos.
Taboos, you have taboos, right?
Superstition.
No, don't touch dead things, or
Look
look
at
at
certain
even
things.
look at dead things. Can't even look at
Because
it.
it'll give you a sickness,
So it'll give you
whatever they have. or-
some kind of sickness. You have witches, you have skinwalkers.
Mhm.
That I haven't heard anybody even talk about skinwalkers. Evidently, you can't even say the word skinwalker. I can because I don't wash my hands. I do. From
The other reason why I put the paper towel on the handle
Oh,
when I exit.
I had a colleague at Ashford, and he wouldn't touch anything. So this is funny. The door was closed, and he couldn't open the door. He had to wait for a student to go in so that he could go with them. He was a lawyer too. This guy was nuts. But if he handed out papers, he would take a sheet of paper and he would fold it, and he would grab each sheet of paper with the paper to hand out to the student.
Okay, I'm not that extreme.
Okay, but he never touched anything that other people had touched. It was funny. He didn't shake hands. He had a problem with his keys. He would get a Kleenex to get the keys out of his pocket.
Okay, I'm not.
Okay. Then he'd put that Kleenex in his other hand so that he could, so he's transferring the keys so that he can unlock his door with his own damn keys that were in his own damn
What was
pocket.
this again?
Ashford, it was at Clinton, Iowa.
So this was like before antibacterial.
Oh no, he had antibacterial soap all over the place. He was funny. And anytime he passed, and of course they had that outbreak, there was some kind of an outbreak. It wasn't HIV, it was something else. Anyway, there was an outbreak, and they put this stuff all over the place. So like every hallway had one of these Purell dispensers. Well, every time he passed one, he had to get some Purell and wash his hands. As crazy as that is, he was funny. Because you go up to him and you go, "Oh, hi, how are you?" And he'd pull his hands back because he thought maybe you wanted to shake hands with him, but he'd go like this, So he's walking around with his hands up so that nobody will touch him. It was just a hoot. And he was a lawyer. And of course, that's why he was no longer a lawyer. He was teaching. He was teaching criminal justice. But he was no longer a lawyer because he had to deal with people that he felt were tainted, were dirty. And he couldn't handle it anymore. And he was brilliant. He was just a brilliant man.
And we're going to learn about how, in chapter 14, we're going to learn about how people develop that.
No, we're going to talk about it. We're going to talk about some of these cultural things because all cultures have their own taboos. As strange as that may be. Well, it's not that strange. Everybody has their own taboos. So, and of course, the Dene have theirs. You have taboos about snakes and whatnot. The Apache have their own, and they're another Athabascan speaking group. Their language is almost the same as yours.
And then our Ojos. another thing too.
The Ohos?
Ohos in Spanish or Mexican culture. Evil eye.
Oh, sure. Well, there's evil eyes all over the world.
Yeah, I know.
We're like the only ones that don't have evil eye. What's going on here? That's no fun. Psychological disorders are defined as rare behaviors that somehow impair the individual. Somehow it gets in the way of their functioning. The problem, what type of impairment is problematic, and what if a behavior that is rare in one context is not rare in another context? So we're going to talk about some really interesting problems around the world. Indeed, some psychopathologies are more prevalent or manifest in highly different forms across cultures. Anxiety in the United States, of course, depression in the United States, relatively common, but not so much in China, even though they have similar symptoms. They don't call it depression. And we're going to talk about that in a minute. Experiencing a culture-bound syndrome generally requires one to have cultural beliefs associated with the syndrome. So if you believe that this is true, then potentially you'll have this problem. So if you accept this culture, now you can have this problem. But you have to accept the culture. Okay. I got in trouble up at Fort Belknap. Damn it. I got in trouble because I didn't go to a funeral. And up there, everybody goes to the funeral. Everybody. Wakes, yeah. But this was...
The
this
body
was,
lays right in front of you all
Yeah.
night.
They have wakes. And if he's a veteran, then a veteran has to stay there and guard him during the night. And that I always got the 2 o'clock to 6 o'clock.
Night shift.
They don't call us Belaganas up there. They just call us idiots, I guess. I always got the 2 to 6 o'clock shift. And usually there was somebody that was, oh, you're going to be here from 2 to 6 here, I'll stay with you. You know, it was one of those kind of deals. A little bit spooky, if you can imagine. The dead guy's sitting or laying right there. He's been dead for a while.
Did it smell?
I'm sorry?
Did it smell?
No, of course not.
No formaldehyde.
He'd been embalmed. Well, yeah, there is that kind of that interesting odor that comes off of him. This is an example of something that's culturally a cultural problem. Dhat is a morbid anxiety seen most frequently among South Asian males, that they are losing or leaking semen. And it is believed that the loss of sperm results in the person getting seriously ill. These individuals feel that they only have a select amount of semen for a lifetime, and it gives them energy, it gives them their power, and they're afraid that they're leaking this stuff. So, you know, it's going to come up to their 50th year and they can't do it anymore. They don't have any semen left. And they're scared. They're really scared. This often results from anxieties about disapproved sexual acts such as masturbation. They're afraid that it's getting away from them. They're using too much. So despite the fact that masturbation is relatively common throughout the world, both with males and females, these individuals are afraid that they are losing too much semen. As confusing as that is. This Dhat would be meaningless label in the United States. However, where there are no cultural beliefs about the vitality that sperm endows, and no cultural beliefs about the consequences of loss of sperm, that is us in the United States, of course. Is it possible that other cultures suffer from some psychological disorders as the West, but don't have the same cultural beliefs associated with Western diagnoses, making them meaningless in other cultural contexts? In other words, anxiety, or depression, or OCD. Maybe this is common in other cultures, to the extent that they don't even think about it. It's possible. It all depends on cultural beliefs. Hikikomori is a Japanese problem. Hikikomori is a condition in Japan characterized by living in an asocial state, with no intimate relationships with anyone outside of the immediate family. Are you ready for this? These individuals, it first appears in junior high school when they're going through puberty. They end up reading books. How horrible is that? Watching television, oh my God, not really, and playing video games in their rooms, and that's it. Sounds like you, doesn't it, Jeff? It indicates the cause may be a failure to succeed in social world that has few options for those who don't fit in. Remember, this is a Japanese culture, very, very crowded place, Japan. So these individuals, instead of being social, interacting with their comrades, with their cohorts, with their classmates, these individuals are recluses. And being a recluse in Japan is not acceptable behavior. In the United States, obviously it is. We have kids that don't get along with other individuals. We've got kids that don't play well with others. We've got an awful lot of kids that are obsessed with just eat the whole damn thing.
No cool.
We have kids that are obsessed with video games. And most of them are right here in this classroom. It does not conform to criteria for any of the DSM-4R revised diagnoses.
What about 5?
Doesn't
right?
No. It has only recently become a cultural phenomenon, as is now seen, although rarely, in other East Asian countries. It started out in Japan. What does it have to do with it? It has to do with technology. It has to do with the fact that you can play video games for an extended length of time without, well, you have to pee, but other than that, you can pause the thing, can't you? Okay, good.
And save it and then
Right.
wait and come back.
Of course. Yeah. I've known people that would play video games for 72 hours straight. Oh, you think that's
fun.
common?
It's
okay.
I used to do it all the time.
Yeah, what they would do is they'd start playing video games on Thursday night, and they'd play all the way through Sunday. Sometimes these guys wouldn't come to class on Monday because they'd stayed up for 72 straight hours playing video games. And they thought that was a good excuse. This is for Halo 2 was the game that everybody was playing for no
So did
reason.
they just...
It was horrible. And so
Well,
I
if
kept
you're-
yelling at them and shaking my finger at them. It didn't make any difference. They still played. And they brag about it to all their friends. And they would do things like take pictures of the screen.
Oh.
I don't know. That didn't make any sense to me. I didn't understand. And they would pass these things around.
If you were stuck on something, maybe someone could help you with that.
I have no idea. But there were a group of these guys. And the odd thing was that they were obsessed with Japanese cartoons for some reason. Anime, yeah. And 2 of these guys wanted to go to Japan to teach English to the Japanese. Okay. And marry Japanese hotties, shorties. Approximately 1 child per classroom in junior high and high school is afflicted with hikikomori.
Hikikomori.
Hikikomori. Oh, you're good at that. You've heard of this before?
Yeah.
Oh. Largely non-existent in pre-war Japan and uncommon in other cultures, it is very common in Japan. As you can see, Japanese houses are very small, so their rooms are just crowded with crap. Because they obsess over things. They obsess over, well, she's got all kinds of stuffed animals. Anyway, Hikikomori. So you've heard about this?
Mm-hmm.
Okay. You don't have it. How can you? You're not Japanese.
Yeah, I'm not Japanese. But I guess you could say I have it. Right?
Bulimia nervosa is uncontrollable binge eating. Individuals then take inappropriate measures to prevent weight gain, like vomiting, but they eat a lot. Absent in most cultures of the world, making it a culture-bound syndrome, especially in cultures where food is not abundant. Why in the world would you have bulimia in a place like Africa where they don't have enough food to eat anyway? So you're certainly not going to have bulimia, but it's relatively common in the United States. Eating disorders affect many people in the West, but there are many nuances when it comes to determining universality of these conditions. Bulimia appears to be a culture-bound syndrome because rates have increased over time, and the age of people being diagnosed with bulimia has gotten lower over the years. And now we're seeing elementary school girls who are vomiting to stay slender.
Boys too.
Boys too. Well, yeah.
Well, not as much, but they're
Not as
seeing it
much.
more now.
The wrestlers do. It's also more prevalent in some societies, particularly those with Western influences. It's very common in Japan. Japanese are skinny people. Slender. I'm sorry, did I say skinny? I meant slender. They're very slender people. But, well, let's take a look at this chick back here. There you go. She's pretty damn tiny. She's pretty tiny. If you can't see their pelvic bones, if their pelvic bones don't stick out, they think that they're fat. Remember, in Japan, it's against the law to be overweight. As horrible as that seems.
But if they're older, is it still they still have to be skinny or slender?
I'm sorry?
If they're older, do they still have to be slender? Or is that just everyone?
It's usually the younger girls
Okay.
that have this problem.
No, I mean like just in general. So I was asking, like, is it too?
Well, even the older women are fairly slender. You're not allowed to not worry about your weight until you get into your 60s and 70s. It's horrible as that is. So it's we think of bulimia as a culture-bound syndrome. However, anorexia nervosa, very common around the world. An individual's refusal to maintain normal body weight due to preoccupation with their body in one way or another. Evidence of culture-bound status, a huge increase in rates of anorexia this century, primarily found in only some cultures, like your Western cultures, and in Japan, and in China. And when we're talking about China, we're talking about over 1.2 billion people. Evidence of universality, reports of self-starvation in numerous cultural contexts but not due to body image. In some places, it is done for religious reasons. As with bulimia, rates of anorexia have significantly increased over time, and it is absent in many cultures. However, it has been found in cultures that have very little Western influence, and it is also manifests differently in some other contexts as well. Symptoms resembling anorexia have also been noted among ascetics who refuse food for religious reasons, and in the 17th and 18th century among teenage girls who starved themselves to model themselves after the ascetics. So they weren't doing it to look attractive. They weren't trying to be pretty. They were doing it because they wanted to emulate these religious people that were doing it for religious reasons.
Kind of like fasting in a way?
It is fast, yes,
Yeah,
it is. My wife used to work with a lady who would fast 4 days out of 7. So 4 days a week she didn't eat anything at all. She was all bones. I would say she was skin and bones, but she wasn't. She was just all bones. She looked skeletal. The doctor, she worked in a clinic. My wife ran the clinic. And the doctors would try to get this lady, they were telling her she's anorexic. You're going to hurt yourself. You're going to damage yourself if you're not careful. But she was doing it for religious reasons. She had been to India. In India, there are individuals that don't eat for an extended length of time, and they go into nirvana. She was one of those hippie chick people, kind of. And she had picked up this idea in India. And when she came back to the United States, Christianity hit her like a ton of bricks. And so she decided that she could pray and fast for people, and that she could cure them of their problems. And this lady was a nurse, and she worked in the I know, it was crazy. But she was like 6'2" or something, and weighed maybe 115 pounds. I mean, it was nuts. It was crazy. Did she have anorexia? Yes, of course she had anorexia. And what the problem was that she was doing it for religious reasons. And because of that, the doctors couldn't convince her that she needed to eat more food.
Did she get any health problems after that? Because she did so much?
She would when she got sick, she had no reserves whatsoever.
Oh.
So if she caught a cold, it lasted for weeks. lasted forever. Yeah, I know. And she would, of course, she would fast and pray some more so that the cold would go away, and she'd just get worse and worse and worse. It was nuts. Gandhi used to fast. He was an ascetic in the 20th century, of course. This historical record of anorexia, as well as evidence of anorexia in many non-Western contexts, have led some to argue that it is a universal disorder, although it may serve different functions in different places. For example, religious reasons versus weight loss reasons. And of course, that's why the Hindu Gandhi was doing that. He felt that how can I say that? He felt that he had too many sexual thoughts. So Gandhi, in order to fight those sexual thoughts, would sleep with a naked woman. He was an ascetic. He wouldn't do anything. He didn't have sex with them, but he slept with them. And they were naked and they were next to him. So what he was doing, he was challenging himself. And that made him stronger. Okay. Isn't that exciting? Koro. Koro is a morbid anxiety about one's penis shrinking into one's body. Koro. Primarily found in South and East Asia, it is unclear what aspects of the culture have led to the emergence of Koro. Koro-like symptoms have been found in some individuals in West African cultures, as well as in individuals in American culture who have had negative marijuana-induced experiences. Koro, the idea that your penis is shrinking, that's going to go away. It's going to go back up into your abdominal cavity. This is very common in Japan. It's very common in China. In India, they're afraid they're losing semen. In China, they're afraid that their penis is going to dissolve. Amok. To run amok, you've heard this term. It's an acute outburst of unrestrained, violent, and homicidal attacks, preceded by brooding, followed by exhaustion and amnesia. So it starts out with you brooding, and it ends up with you attacking someone, or doing something extremely violent, and then afterwards you're exhausted and you can't remember that you just did all this crazy stuff. It's called amok. It's very common in Southeast Asia. I know, as confusing as that is. It may result from having no acceptable means to express frustration. It's socially unacceptable, so it builds up and builds up and builds up. It's like a tic. It's like Tourette's syndrome. It builds up and builds up and builds up until you have to dissipate it, and the only way you can dissipate it is with violent acts. The Vikings used to have referred to bloodlust, this concept of being berserk. They would go into battle and they would just start, they would be fighting frenetically, swinging their axes as rapidly as they possibly could. And this was known as berserk. I have a feeling this may have something to do with why we have 26-year-old men taking AR-15s into churches and just trying to kill everybody, firing 450 rounds in like 5 minutes. How do you do that? How do you reload that fast? Hysteria, a commonly diagnosed condition in the 19th century Europe among women. Symptoms include temporary blindness, potentially temporary blindness, insomnia where you can't sleep, fainting spells, loss of appetite for food, or loss of appetite for sex. One of Freud's most famous case studies was of a woman who was paralyzed from the waist down. Do you remember? Okay, yeah. She was paralyzed from the waist down because she was having sex with her husband and she moved. Because she was having such a good time, she moved. And she felt so guilty about it that she developed a hysteria where she became paralyzed so that she wouldn't do it again. The other lady, of course, is the lady who saw her husband's penis. This was a time when you didn't view other people's bodily parts, and she went blind because she saw her husband's penis. as strange as that may seem. Rates of hysteria diagnosis dropped dramatically in the early 20th century. Some think that it is due to its being replaced by other diagnostic categories, while others think that it was associated with repressive Victorian cultural norms, which is probably true. If we look at many of the diagnoses that Freud was making, he was making it in a very repressed society, in a very repressed Victorian society. So it's very logical. People say, oh, Freud's full of bananas. Well, Freud wasn't full of bananas for the era that he was dealing with, for the problems that he was dealing with. We don't see this stuff anymore. As a matter of fact, last night, was it last night? No, night before last. Tuesday night, we had all the women wandering around in their underwear in Shanghai. Victoria's Secret from Shanghai was on Tuesday night. I didn't watch it. I missed all the underwear. Damn it. I missed all the underwear. Oh well. Which is exactly. Phrygophobia. Phrygophobia is very common in China. It's a morbid fear of catching cold. These guys will dress in winter clothes in the summertime because they don't want to get cold. They will stay inside in tropical heat in order not to catch cold. They will layer their clothes that they wear. They will avoid cold air. They won't eat cold food, of course. Who would eat cold food anyway? They dress with several layers, of course. And this is known as phrygophobia. Very common in China, as odd as that seems. Okay, another culture-bound syndrome. Do we have it in the United States? I don't know. I think I married these women over and over again. No, just my first wife had phrygophobia. Susto is a frightening condition in which a person thinks that their soul has been caused to become dislodged from their body. What could be worse than a dislodged soul? Causing a variety of physical and psychological symptoms. It's very common in Latin America.
It's like the same thing as like Gesundheit. You like lose your soul for a second. Yeah. Okay.
Yes.
How do you say that again?
Gesundheit. Like how you say, or
Right.
they'll bless you and then their soul comes out and they've gone away for a little bit and come back.
I've never heard of that. I've always wondered why does people say bless you or Gesundheit?
To keep your soul in. That's what I was told when I was.
I never say it because I want to keep my soul in. Okay.
That's what I was told. I'm like, okay, that's interesting.
Voodoo. Voodoo death. A person is convinced a curse has been placed on him or her, or he or she has broken a taboo. Of course, if you break a taboo, then your soul will die. Results in severe fear reaction, which may actually lead to death. You can die if you think that you're going to die. If you decide right now that you're going to die, your heart will stop beating and you'll die. You can stop your own body from living. So these people are so afraid that they actually do kill themselves. And it can happen. If you believe it's going to happen, if you have that strong a belief system.
So is it similar to like you could have a broken heart because you think you don't want to be alone or someone, or
A broken heart?
Because don't they say you can actually die from a broken heart too?
You can die from, especially if you commit suicide. That's usually what happens.
Okay.
Lovers' leaps.
Oh yeah.
Okay.
Yeah, never mind. Never mind with something else. I didn't mind.
This is, of course, voodoo is very common in Africa. It's an animism religion. It's also relatively common in the Caribbean, in select places, and in New Orleans, of course.
So that's only if you believe you're going to die.
Yeah, well, of course.
But
Yeah.
if you choose to ignore it, you don't believe in
Yeah.
that for real.
Yeah. So if you guys believe something and I don't believe it, then whatever you believe can't hurt me because
So it's choice.
it's just like your germs.
It's very mild.
You have to wash your hands, but I don't, and I'm still okay. Because I know that, I know.
I'm just thinking about that door handle.
I know, it just gives you the whim-whams, doesn't it? Lata is a transient dissociated state brought on by a startling event, followed by engaging in cultural inappropriate behavior, after which the person has no memory of the episode. Lata. It's found primarily in Southeast Asia, but also in Siberia and amongst the Ainu in Japan. The Ainu, of course, are the Caucasians that live in Japan. So they will do something inappropriate, like fart or run around with their tongue stuck out or whatever. They'll do something inappropriate, but they won't remember it later on. It's a tic disorder. Once again, it's a tic disorder. It's only common in select areas. Malgry is a concern that one has been invaded by totemic spirits that makes them sick, tired, and drowsy because they entered the sea or a new territory without having engaged in the appropriate ceremonial rituals.
What is a totemic?
Totemic?
Yeah.
Spirits? Totems?
Oh, okay.
Okay. So my totem is the wolf. So in order for you to talk to me, you have to go through a ritual, the wolf ritual.
Okay.
Okay. Totemic spirits. So certain areas has certain totems. This is in Australia. It's with the Australian Aborigines. So they will get sick because they didn't do the appropriate ceremonies. Now this is really kind of interesting because the Grovan have two pipes, and I think I've talked about the two pipes, but they have two pipes that protect their tribe. Well, one of the pipes, they still know all the rituals, all the appropriate rituals, and I can't remember which one it is. Do you remember, Michelle? Is it the feather pipe or the flat pipe?
Probably the flat pipe.
The other pipe, nobody can remember how to do. They can't open the bundle, so they can't use it because they don't know the proper ceremony, and they're afraid if they do it, it will break the connection between them and the Great Spirit. So they can only use one pipe. They have two pipes to protect themselves, but they only have ceremonies for one of the pipes. And this is a similar situation. You have to do the appropriate ceremonial rituals. And if I remember, about 8 years ago, somebody said that they were going to open the other pipe. They were going to open the bundle. And everybody on the reservation is going, no, don't do that. It could bring the end of the world. Because they don't know the right ceremonies to open up the bundle, so that they can use the pipe. And I've actually seen one of the pipes. I think it's a flat pipe. Isn't that the one that Joe Ironman had?
Like that one's for like the ground, and then the feather pipes like the sky.
Yeah. I've never seen the feather pipe. But then again, nobody's seen the feather pipe because they can't open the bundle. Agonias is an anxiety disorder that includes a burning sensation, loss of breath, and sleeping, among other symptoms. It's primarily found in Portugal and the Azores, Agonias. And of course, the Azores are controlled by the Portuguese. So this is a Portuguese problem, Agonias. As odd as that seems. It gets better. Are you ready for this? Kufungis. And you can tell Sarah that you've got this problem. Kufungisisa is an anxiety and somatic problem associated with mental exhaustion stemming from too much thinking. Too much thinking. It's primarily found in Africa, the Caribbean, among some Native Americans, and East Asians. Not this tribe, obviously. So, there you go. Tell Sarah you've got Kufungisisa. I guess. This is not a Japanese problem, so you don't know how to pronounce it. Yeah. Okay. Too much thinking. Too much concentrating. Attacks des nervois, feeling palpitations, numbness, and a rising heat sensation during emotionally charged situations such as funerals. It's an attack of your nerves. Attack of nerves is what it means. It is. It's been found in Puerto Rico. The Puerto Ricans, we see this all the time. They'll have nervous breakdown, or just an attack of nerves is what it means.
So it's a nervous breakdown?
No, it's just a momentary lapse of control. Let's say that. We can say that. Okay. I had a friend that was from Puerto Rico, and he had these from time to time. Usually it had to do with sports.
Oh.
And he was a boxing fan, and when the wrong guy won, he would have one of these attacks. I thought it was funny. And the funny thing is, he wouldn't remember. He'd punch his fist through the wall. He'd kick through. Well, you know him, Manny Morales. Manny Morales.
Morales.
He's got all the Morales kids. All the Morales kids are his kids. Yeah, Manny's from Puerto Rico. He's funny. He's a funny guy. He had one of these attacks after they fired him. He was so pissed off that, and of course he went to the president and started screaming at him because she had just fired him. And well, anyway. Universal syndromes highlight the biological basis of these psychopathologies. Still, prevalence and manifestations of these disorders may differ across cultures. And of course, some of these things, and we can talk about some of the problems. Major depressive disorder is diagnosed, given 5 of the following 9 symptoms: depressed mood, inability to feel pleasure, change in weight or appetite, sleep problems, psychomotor changes, fatigue or loss of energy, feeling worthless or guilty, poor concentration, suicidality. We see a lot of these symptoms in some of the problems that other people were having. Other cultural problems, feelings of worthlessness, fatigue or loss of energy. Yeah, we saw that.
Let's see a psychomotor change.
Where is it? Oh, psychomotor change?
Yeah.
Is it when you get slower? When you get slower as you do things?
Yes.
Oh.
Yeah, you just slow down. Psychomotor change. So you just don't have, you can't quite, you'd like moving in slow motion. Psychomotor change. But it's your brain that's slow. It's not everything else that's slow. So, you know, somebody tells you to put on your shoes and takes you a while to get your shoes on. My son has this problem. Can't get his shoes on. Major depressive disorder has been found in all cultures that people have studied. Prevalence rates appear to vary. Depression prevalence rates vary in the United States based on diagnostic criteria. The rate in China is about 1/5 that observed in the West. Wait a minute, so they don't have depression? Sure they have depression. Why are there so few Chinese with depression? Wait a minute, I got
Maybe
the answer.
it's a cultural thing.
Exactly.
They're used to it or something.
Exactly. I went the wrong direction. Did I? Oh, good. One proposed rationale for this is due to 2 different manifestations of symptoms. Somatization, our symptoms are primarily physiological, such as loss of appetite. That's a physiological problem. Psychologization.
Psychologization.
The psychologization symptoms are primarily psychologically, such as depressed mood. So if you feel depressed, that's a psychological manifestation. If you lose your appetite, that's a physiological manifestation. So you have 2 different aspects, like the psychomotor change. That's obviously a physiological change. But there are also psychological changes. Many Chinese psychiatric patients are diagnosed with neurasthenia. We don't diagnose with neurasthenia anymore. But if we look at the DSM-3 and the DSM-4, it's in there. It's not in the DSM-5. Neurasthenia. Neurasthenia are the physiological symptoms of depression. And we don't even talk about this anymore. So neurasthenia is sadness, in essence. Dysthymia. It's a minor form of depression. Poor appetite, headaches, insomnia, inability to concentrate, all of these are physiological problems. And that is what they diagnose people with in China. But in the DSM-5, there is no neurasthenia. It's gone. It's completely gone. Some have argued that most Chinese neurasthenia actually qualified for depression, even if only 9% of them report feeling depressed.
I have a question. So
Because in Japan or in China, you can't say you're depressed.
so I know there's major depression. So is there like minor depression and like the
Minor
situational depression? Or?
Yeah, there is situational depression.
So are those the 3 main ones? Or
Dysthymia and neurasthenia.
Okay.
That's what we used to diagnose, but we don't talk about those anymore. It's not, since it's not major depression, we don't even diagnose it.
Okay. I was just
Okay, we probably call it situational depression instead of neurasthenia or dysthymia. Old terms that we don't use anymore. Social anxiety disorder is a fear of acting in an inept and unacceptable manner, leading to negative social consequences. Research has shown that East Asians exhibit more social anxiety symptoms than European Americans. Does that make sense? Why would they have more social anxiety than we do?
don't think, isn't it hard for them to interact with other people?
It's hard for them to interact with other people?
Like, people they don't know versus people who know.
Maybe. Should I feel social anxiety? I'm dressed in a Hawaiian shirt in December. Oh, I'm sorry, it's still November. Last day of November. Should I feel social anxiety? Should Jeff feel social anxiety for having the Golden Girls on his chest? What?
Yeah, it's a Golden Girl shirt. I got it from Target.
Oh man, I hate the Golden Girls. You get a.
I know, that's why.
Stay golden.
Stay golden.
So why would a European Americans not have as many social anxiety symptoms as? Why would Americans not have as many as East Asians? Yeah.
Maybe because the Asians grew up in a very strict household and they're not taught like
There you go.
being open and compassionate.
There you go. There you go. So as Americans, I can look like I can wear stupid looking shoes that are the same color as Jeff's shirt and have a Hawaiian shirt on and not feel social anxiety. I really don't care.
But if that situation was in Asia, if there
Right, yeah, of course, we would all have to look alike. And if I didn't, I would suffer from social anxiety.
And isn't that why they also have
We are
schools? They wear like vests and uniforms for their schools.
They wear uniforms, exactly. Exactly. So their social anxiety is more acute than ours is, because as individualists, we dress any way that we want to. We act any way that we want to, and we don't care.
So as Americans, we have less
Social anxiety. We have less social anxiety because we see ourselves as unique. I guess that's logical, isn't it? Sure. Why not? But we have more depression because it's culturally acceptable in the United States to be depressed, but not in Asia, where they can only talk about their physiological symptoms, not their psychological symptoms, because that's not acceptable in China. So they have 1/5 the level of major depression that we do. They have minor depression. They have neurasthenia because they only talk about their physiological symptoms. It has been documented universally, but counterintuitively, it is less documented in East Asian countries than in North American countries, despite greater concerns about social harmony and maintaining faith in East Asia. We're talking about social anxiety. Certainly, East Asians exhibit greater social anxiety symptoms, and there is some link between interdependence and social anxiety symptoms. A good example is that Japanese Hikikomori.
Oh, okay.
Why in the world? We have the same thing in the United States. We may even have it in this guy right here. I'm just kidding. But we have a lot of people that lock themselves in their room and play video games for 72 hours.
Yeah.
They collect video games. Oh my goodness gracious, that's what Big Bang Theory is all about.
Video games.
They read comic books. They are reclusive. But in East Asia, especially in Japan, if you are reclusive, then you are seen, there's something wrong, obviously something wrong with you. So they have come up with this problem, this name for a problem, and in the United States we don't even recognize it.
Yeah.
We celebrate the fact that those kids aren't
Anything bad.
aren't smoking dope and doing bad stuff, that they're up in their room playing video games. You're going, okay, that's good. How are we going to cure this kid of smoking dope? I know, we'll give him video games and make him stay in his room for 72 straight hours. That'll cure him. In general, though, the rates of social anxiety disorder in North America and Europe are 14 times higher than rates in East Asia. And it's because they can't admit things. They can't admit that they have a problem.
I haven't. So,
Yes.
Hikikomori, do they learn to become social, or is later? Because I know
They try to condition them out of it.
Because I know I used to do that in high school and middle school a lot. Now I don't do it as much, but now it's turned to anime instead of video games. so
Okay.
yeah.
So you don't have a problem.
I try to socialize, but I'm not very social as I used to be. Yes. So I kind of reclusive, I guess. Still a little bit.
You're social in my classes.
Yeah. It's not. It's,
Is it my fault?
no.
Have I broken you? Were you fixed before and now you're busted?
No.
And it's because Michelle won't leave you alone?
I'm trying to interview him.
this is an intervention.
No. I don't notice that. I'm very like at the dorm. I'm usually by myself and just hang out in my room and do my homework and just.
Doing your homework is okay.
Exactly.
It's playing the video games.
And watching anime.
Yeah,
Yeah.
watching anime.
Yes.
Unless it's a pornographic anime.
Oh no.
Oh my God, no!
It's yes, like really kid.
I'm just kidding. Is there pornographic anime?
Yeah.
Okay.
Hentai and yaoi.
People are attracted to that, right?
Yeah.
Like sexually?
Yeah. Oh sure. Yeah.
Yaoi.
Women with no mouths, big eye, great big eyes. Yeah. And the odd thing is they become eye men, or they become, I don't know, boob men, because boy, those ladies they have some huge mammary glands. I don't know if you've ever noticed, but they're all Western. All the women with large breasts are Western, because
Or half.
Japanese don't have big breasts.
Half American, half Japanese.
Yeah.
In the anime, yeah, usually.
Yeah, it's really kind of interesting. It's fascinating, isn't it, actually? It's all culturally based. It's the Japanese attacking the West. We're all gaijins.
Yeah,
all
'cause
the
they're
all the
usually-
bad people in Japan are Westerners.
They're usually ditzy and don't know what they're doing when they compare Americans to Japanese characters. It's very interesting.
Yeah, it is kind of strange. Well, I showed you that one video.
Yeah.
Yeah, okay. And that's a Japanese kids show where all the bad lady, the black rabbit,
Cockroach. Or,
the black rabbit was Western, obviously. Okay. And of course, the Japanese girls
couldn't drink milk.
they couldn't drink milk, but they also dressed in cute little fashions. And the American girl dressed in
It's a tomboy.
a jumpsuit, and looked kind of goofy or different. In Western cultures, the norm is for people to be extroverted. In East Asian cultures, of course, the norm is for people to be introverted. And for that reason, of course, social anxiety is more prevalent in East Asia than it is in the United States or in Western cultures. That's not to say that social anxiety does not exist. Social anxieties do not become a problem in East Asian cultures. There is a culture-bound disorder called Taijin Kaiyu Fushu, or a fear of confronting others. Taijin Kaiyu Fushu. It is a fear that is solicited by social situations such that one is concerned about how uncomfortable one makes other people feel, perhaps because of their gaze, body odor, or sweating. So the more you worry about it, guess what? The more you sweat. And the more you worry about it, the more likely you're going to have body odor. So yeah, okay. But of course the Japanese don't have a very strong body odor. And they don't sweat nearly like white people do, right? It is similar to social anxiety disorder because it is effectively treated using the same antidepressant as is used to treat social anxiety disorder. It has thus far been limited to Japan, China, and South Korea. Not North Korea. Well, we don't know what's going on in North Korea. But Taijin Kaiyu Fushu. Suicide rates vary dramatically around the world. Eastern European tends to have the highest rates. Eastern Europe. Muslim nations tend to have the lowest because it's against their religion. Suicide rates also vary depending on one's age, with the elderly generally being more likely to commit suicide in most cultures because they're trying to take themselves out of the social situation that they find themselves in. There is a special case in Micronesia in which there is a spike in the adolescent age group. This started primarily in the 1970s when the spate of suicides occurred among adolescent men over seemingly trivial problems with no obvious psychological issues to begin with. So these kids just killed themselves. Why? Well, their cornflakes got soggy. Oh. These suicides were also restricted to specific islands, particularly the suburban regions of those islands. In other words, they were in the around the cities of these Micronesian islands. Some have suggested that this spike was due to westernization of the island, leading to a loss of traditional roles for young men. And since they had nothing to do, they used to be important, they used to have this to do. Potentially we could have seen it with indigenous populations in the United States. And people have talked about, some of my students have talked about what traditionally men were supposed to do. So what are you traditionally supposed to do now? The women tended the crops, they took care of the livestock, and they took care of the family. They took care of everything here, and the men went and hunted, and they collected firewood. Okay, and these are jobs that men have. Of course, as you were put on reservations rather than being free to roam wherever you wanted to, all of these jobs changed. There was no meat to hunt. There was nothing to hunt. So all of a sudden, you had to do something. What did the men do on the Navajo reservation?
Adapt.
They started farming.
Gathering.
Yeah.
Farming.
They started doing women's work, which was something that they wouldn't have done 500 years ago. So everything changed.
So it all affected mainly based on their masculinity, manhood?
Right, it attacked their masculinity. You can think of it that way, potentially.
But that's an issue, right?
Right, well, it could be. Well, and obviously it was in Micronesia, where these guys, they lost their concept of manhood, and now all of a sudden they committed suicide because they couldn't be the men that they were supposed to be, as tragic as that could possibly be. What is it? Suicide rates per 100,000 by age and country. Egypt, USA, Hungary, Japan, and Micronesia. Here's Micronesia, as you can see. They have the spike in the age group. This is when they go through puberty, between 15 and 24. And if they can't resolve this problem, they just kill themselves. But we don't see that in any other culture.
I thought Japan or that area had a lot more because of the stress of schools and stuff,
Schools?
and universities. Social
Where is it?
pressure.
That's right. Japan's about the same as everybody else, and all of a sudden they had
Okay.
that spike right here, 25 to 34. You know, they've got that woods where everybody goes out and kills themselves. I know. That's bizarre.
Oh, that was real?
Yeah, they've got a special woods. It's a special place in Japan where you're going to off yourself. You go to this place,
I've heard about it.
and you either some people just wander off into the woods and die, and other people do things to themselves. Oh, I'm sorry. Yeah, no, I'm sorry. This is Hungary. I apologize. That's Hungary. Here's Japan. Yeah,
Also a slow increase.
I'm sorry.
Okay.
United States is fairly low. Egypt is a Muslim country, so they don't have suicide. Losing connection between one's cultural narrative and modern society, lack of cultural continuity, seems to put people at risk for suicide. So you would think there'd be more suicide among indigenous peoples because theoretically, you've lost your culture. Many First Nations bands do not have a strong sense of cultural continuity due to Western colonization. Many youths cannot identify with their traditional culture and are also unable to identify with mainstream Canadian culture. Here we're talking about Canadians. Why is it worse in Canada? Why is it worse in Canada than it is in the United States?
Wasn't it worse for the indigenous people when they were being slaughtered more and assimilated more?
They have a different attitude. than in the United States. It was bad enough in the United States, but it's worse in Canada. Don't say that to Sarah, she'll get all upset. Support for this argument, but this is a Canadian author, and he talks about it, so. I know, we'll never have to talk to Sarah about it. Don't worry, she's going to Tuba City. Support for this argument has come from findings that bands with stable connections to traditional cultural past have lower suicide rates. Such a connection is indicated by negotiating a land claim with the government, possessing self-government, maintaining control over educational services, controlling their police and fire services, managing health services and cultural facilities. This has just taken place in Canada. It has just happened in Canada. The reserves have become more independent. Before, of course, they were an English Commonwealth, and the Brits don't let that stuff happen. And of course, the Canadians didn't let it happen because they wanted to be English. So they were treating their indigenous populations very poorly. They weren't allowing them to do anything. They weren't allowing them to maintain their culture. The only places that were allowed to maintain their culture were the ones that were far enough away from the cities and the capitals of the Canadian provinces. It's the only places that we didn't see this because they were able to maintain their own culture. But the closer you got to the cities, the less they allowed them to maintain their own culture. And I've talked about this before. I know it sounds like I'm attacking people from England, and I am. The English, when they conquer somebody, when they take over a country, they treat the population as subordinates, as prostitutes. So they utilize the females as prostitutes. And this has happened in South Africa, it happened in Canada, it happened in Australia, it happened in India. They turned the female population into prostitutes. And that's still going on in Canada today. Far worse than it is in the United States. I'm not saying it's not bad in the United States, I'm saying it's worse in Canada. And of course, the suicide rate is much higher in Canada than it is in the United States among the indigenous population. One fundamental hypothesis that researchers have found support for is that the lack of connection to one's cultural roots is a strong predictor of suicide rates. So the stronger, and this is one of the reasons why this school is so important, should be important to you, because it teaches you your culture. And the stronger your culture is, the less likely you are to react negatively to things. If you're trying to live in both cultures, the Western culture and the native culture, you're going to suffer more. We know that. We've seen it over and over and over again in different populations, not just with the native cultures, but with all cultures. So if you're half Hispanic and half native, and you try to celebrate Day of the Dead, and then also celebrate, some of the ceremonies of the native culture, you try to have a foot in both cultures, it just pulls you apart, and you're going to have potentially mental problems, depression, anxiety, because you can't always be this person. Sometimes you have to be this other person. It's a lot more obvious if we talk about trying to live in the American culture, the Western culture, and trying to live in the native culture. If you know anybody that tries to do that, they probably have a lot more anxiety, a lot more depression than an individual that embraces their native heritage and goes to powwows and whatnot and celebrates their heritage.
What's that called again?
Biculturalism.
Biculturalism?
Biculturalism, the whole idea that you're separating yourself. You're pulling yourself apart. Don't do it.
How do you like biculturalism?
Biculturalism.
And
Trying to
it's
maintain-
what again?
Trying to maintain two cultures at the same time. It just doesn't work.
So if you were going to ask somebody about cultural influences, what would be the best question to ask?
What What culture do you adhere to? Yeah. What culture do you adhere to?
What culture do you inherit to?
Adhere to. What do you identify with?
influence.
Identify with. I guess identify is better than adhere.
And
Sounds
does
like,
it influence you?
Yeah.
Or,
yeah. Yeah. So the people that accept who they are, rather than try to hide half of who they are.
That's what I tried to do in the beginning.
Yeah, and it doesn't work, and it hurts. I mean, you don't belong anywhere. You don't belong in either culture. And that's why there's old television shows where they talked about half-breeds, you know. And this was relatively common in the 50s and 60s, where they were actually talking about individuals trying to live in both cultures. Those individuals were hated by everybody. They were hated by the white population, they were hated by the native population because they dressed incorrectly. They didn't understand the ceremonies. These are the first people that they killed. If there was an uprising, they were the first ones that they killed. Okay, we're still talking about the Canadians. Oh, it's time to leave. Why don't we stop right here? Well, I need to thank you guys because I really had a good time in this class. Last time was the first time I'd ever taught it. It was the first time I went through the textbook, and